The first guiding principle that we provided is to use a strengths-based, asset-driven approach when developing school mental health policy. Using this approach, well-being, resilience, connection, and inclusion should be the goals, rather than emphasizing safety and discipline. This is a shift away from the traditional health education framework because this approach gets at the idea that while not everyone experiences mental illness, everyone has mental health. The second piece of guidance highlighted in the report is to frame educational equity as health equity. This means emphasizing the connection between learning and health, including mental health, and using an equity lens to improve educational and health outcomes, particularly for BIPOC and LGBTQ+ students, through school mental health initiatives, as these students are often most effectively reached at school. This takes the principles of social-emotional learning and applies a framework of equity and inclusion to meet the unique needs of all students. The next principle that we offer in the report is that empowering youth is a key measure of success. It is crucial to include youth in every stage of policy creation, including brainstorming and planning, understanding school and community needs, developing policies to meet those needs, and implementing those policies in a way that can meet young people where they are. Educating youth on the legislative process so that they can fully participate in policy change is a key factor in creating policies that students truly believe that they can benefit from. The fourth principle that the report advises is to work within or build on top of existing structures of state legislation or health education requirements, curriculum, and interests. Synthesizing and respecting existing efforts such as social-emotional learning and suicide prevention helps to build momentum around the issues rather than trying to start from scratch. The second to last principle of the report is to consider implementation, evaluation, and ongoing innovation to be as important as initial policy. We believe it is vital to the implementation process to provide adequate technical assistance for mental health education with regard to effective curriculum, processes, and comprehensive training for the whole school community. Encourage innovation in school-based mental health services such as telehealth, digital tools, and new ideas generated by students and others. Consider evidence-informed approaches and measurement of outcomes to ensure all students can benefit. The final guiding principle that we included in the report is to leverage policy changes for a whole school, whole community, whole child approach. Conduct comprehensive assessments, address gaps, and connect to community resources to improve student mental health, resilience, and well-being. There is no one-size-fits-all policy that addresses school-based mental health, so it is important to factor in the unique needs and strengths of the community, school, and student body for which policy is being developed. I want to shift now into talking about mental health sick day legislation, which is one of the three major topics covered in the report and also highlights the key role of youth-led advocacy. Oregon's House Bill 2191 is an excellent example of both of these ideas. Passed in 2019, House Bill 2191 added mental and behavioral health to existing legislation on excused school absences, allowing students to have excused absences from school to take care of their mental health, just as they would their physical health. The entire legislative process, from the birth of the idea for the bill, to the drafting of the bill text, to all the advocacy and lobbying meetings, was led by a group of young mental health advocates called Students for a Healthy Oregon, with support from Providence Health. Supporting and empowering these young people was crucial to getting the bill passed because the students were able to create and advocate powerfully for a bill that they came up with and actually believed would help. Other states followed closely behind Oregon, passing similar legislation, often driven by young advocates within their respective states. Additional states that have passed legislation regarding excused absences for mental health include Colorado, Maine, Utah, and Virginia. Advocacy organizations and others interested in helping young people advocate for what they need can support youth advocacy efforts by actively seeking out young people who are already doing the work, such as Students for a Healthy Oregon, and offering guidance or resources as needed, allowing young people to be empowered to create the changes that they want to see in their communities.